Beginning of February, most of us in the medical profession started to take notice that something was going on in Asia. The large number of cases there, the severe measures they had to take to control it.
We convened an emergency task force. At the beginning of the crisis, we realized we needed to very aggressively plan for the worst case.
By this fall, we'll have tested over 50,000 South LA residents. But the fact remains that Black and Latino residents of LA are 4 times more likely to die of COVID than anyone else. You must intervene for the most vulnerable first, and that's what St. John's did.
In March is when we started really actively preparing at St. John's. Our CEO formed a task force and formulated a plan to how we're going to battle this virus.
And we mobilized to challenge this horrible disparity in health access. We erected 15 testing tents throughout South LA at our various sites. We retooled our 2 mobile clinics, one to do testing for people experiencing homelessness. We did that in partnership with the Mayor's Office and the Department of Public Health, and then the other to do community-wide testing. Then the issue was to secure the test kits and obviously the PPE, the personal protective equipment.
Our facilities, finance department, our operations, clinical, we ordered supplies before everybody was even looking for PPEs.
We made the decision almost immediately to triage people in tents. And when we ordered the tents, they were still in stock. It feels like it was only a second sooner than some of our peers, but it was a second sooner that was really needed.
We decided we were not going to wait for the supply to become available in the United States because the federal government had failed so significantly.
We need to keep our patients safe and our employees safe, and looking always for ways that we can help staff in terms of burnout, hazard pay, $4 an hour extra for 400 of our frontline employees. We used entrepreneurial methods. We got thousands of masks from China and other sort of things. You have to keep your head straight on and not let just the clinical component lead. You have to say, what is the practical common sense thing to do? And so you have to think ahead in those terms.
Opening dental requires new construction and constant vigilance.
In March, there was virtually no access to testing in South LA. We were able to find a local laboratory, 4 test kits who had an unlimited supply. By the middle of April, we were testing hundreds of people a day. We were testing everyone who was symptomatic.
About the middle of March, we would see 20, 30, 40 patients who looked sick and had all the symptoms really, but they didn't have the necessary criteria for public health department to say, yes, go ahead and test them. There were not enough tests nationwide, statewide. Toward the middle of April, we started really being able to test everyone.
If you're symptomatic or not symptomatic, we still are going to test you if you need to be tested. Going to different areas throughout the week, we're able to test more people, and especially in Black and brown communities where the COVID rate is real high.
For me, living in a city like Compton, California, that is predominantly people of color, I think it's important for me to be here, to get tested, so I know that I'm not spreading it, so that we can flatten the curve, and so that hopefully all of us can get back to work and back to school and back to our lives.
Somebody tested positive on our job, so they just lay everybody off until I get a negative reading. My wife has to go to work. I have to be at home with him, so it's been a little stressful, but it's been okay.
We understood from the beginning that part of the control of this virus will be to test and isolate, and toward the middle of April we added a contact tracing team.
We have a team of contact tracers calling all of our positive patients and trying to get a list of contacts they've engaged with. Then call those contacts to try and get information as to their symptomology, the onset of their symptomology, if they've gotten tested, encouraged to get testing, and self-care.
They have a fear of losing their job. They're the only ones working. They probably have a family of 5, or they have like 2 to 3 families living in a 2-bedroom house. It's really difficult for them, and it's really hard.
Fear and anxiety, depression, we have seen in our community. It's been very stressful.
We have to be on the safe side and recommend the 2 weeks of isolation, which is always a problem. he's here with his new employer. He asked me if I would speak to him, so I did, and I explained the situation. He should have his results here pretty soon.
A couple weeks ago, I had a patient, 67 years old, mild cough, a mild fever. He just wanted to get tested because his whole family was getting tested too. About 16 hours later, he had passed away, and the rest of the family actually all had COVID too. I could not imagine what they're going through to contract the virus that has already killed one of your family members. So I can only be how stressful that you're trying to plan how you're going to grieve him, what kind of services can you even have in COVID-19.
It sounds like you do have symptoms associated with COVID-19, so I'm just going to order the lab test for you.
In the beginning, we are getting so many calls, and we didn't know what to do with those calls. Immediately, within 2 weeks, we created this command center and brought the clinicians there. So anybody who is calling for COVID or symptoms of COVID, those calls are diverted to these clinicians in the command center. Right now, we have anywhere between 3 to 5 clinicians taking the calls, and we are testing 300 to 400 to 500 tests a day right now.
Like since yesterday, we've had almost 2,000 new cases. So it's between like 2 to like 3,000 new cases, and it's primarily in the area that St. John serves. So the need is far greater than we can do, but we're doing the best we can to keep up with it. So it's been tense.
Project Room Key was put together with the city and a couple of different partnerships. Hotels, motels, apartment buildings were turned into safe havens for homeless individuals who didn't have the capability to shelter in place and found themselves on the streets or living in encampments. These sites assisted in providing a safe haven. St. John's provides the medical needs, the mental health needs, and the COVID-19 testing to ensure that if anybody does test positive, we're able to quarantine them and provide them with the supportive services so that they have the best possible outcome.
It is taxing physically, it's exhausting, but it's also very rewarding. You know, you have people thanking you throughout the day for providing the service in their community, and I think it's worth it given we're slowing the spread.
I grew up in the community. I'm passionate about our community. This is what I chose. I chose to work in health.
You want to make sure that you're not a statistic. You want to make sure that you're there in the front line to take care of everybody.
We're providing meals twice a week for 500 meals on average. So we have a lot of volunteers that come to pick up here and they deliver to the clinics. We picked someone that really is on the front line and really supports the most vulnerable people, and it has been, it really feels good.
For me, this is personal. This is my city. We really are the city of angels.
To date, we've tested over 25,000 people and counting. 18% of them, over 4,000, have tested positive. COVID is disproportionately impacting low-income communities of color. People in South LA have not had the luxury of being able to shelter at home. They've had to continue to work because they're essential workers. We're just in a tidal wave of COVID positive test results in South LA. It's imperative we address the issue of racism as a public health issue, of poverty as a public health issue. We retooled everything that we did in order to respond and make sure that we were there for the most vulnerable residents of Los Angeles County, and that's what we're going to continue to do.